Hello and welcome to Health Science 100. I'm Professor Woods. Today we're going to start with Chapter 1, Accessing Your Health. We're going to talk about scientific models for health. Our textbook is Access to Health, the 16th edition. You should navigate to the homepage, click on the window which says Textbook, and access the textbook. It is very helpful to read Chapter 1 before watching this video series for Chapter 1 and before taking the quiz and participating in the class discussion. So what are we going to do today? We're going to describe the effects of healthy behaviors on yourself and others. We're going to compare and contrast the medical model and the public health model for health. We're going to identify the 6 main areas where you can improve health. We're going to talk about modifiable, things you can change, and non-modifiable factors that affect your health, particularly personal, social, and environmental health factors. We're also going to talk a little bit about mindfulness. We're going to summarize the benefits of mindfulness and how they can help you improve your psychological health. We're going to compare and contrast health belief models and social cognitive models and trans-theoretical models of behavioral change. It is part of health is making small incremental changes throughout life to improve our overall health and well-being. And we'll try to identify your current risk factors. That's going to go throughout this entire course. So when students are surveyed, the impediments to academic performance that are most commonly described are stress and anxiety. A lot of students find that stress and anxiety also lead to sleep difficulties, sometimes depression, and often illness. So these are the main factors that we're going to talk about managing: stress, anxiety, and through that improving our sleep, our overall health, and managing workloads. So let's think about top causes of death in the United States, mortality in the United States. The leading causes of death are heart disease, followed by cancers, and then lower respiratory diseases. In your age group, the young folks, typically accidents or unintentional injuries cause a great deal of death as well. So, why should you choose healthy habits now? Essentially, it's because choosing healthy behaviors now, first of all, provide you immediate benefits. Things like improvement in grades, improvements in relationships, improvement in psychological health and well-being. In addition, the changes that you make now while you're young are habits that you adopt now will lead to lifelong health. And lifelong health is the goal here. We're looking to be healthy for as long as possible. And it's really about quality of life. So, does it work? Life expectancy over the last 100 years has improved from about 47 years. That was about in the early 1900s. About 78 years for a person that was born in 2016. In the past, deaths occurred due to infectious disease. But now we're in an age of vaccines and antibiotics, sanitation, clean water, so life expectancy has improved dramatically. But as a consequence, we as people are suffering from chronic diseases more and more. And these chronic diseases are things that build up slowly over time from youth all the way into old age, and diseases that we can improve their outcomes for or avoid entirely through healthy choices now. Okay, so let's talk about some models of health. Firstly, there's the medical model. It's a rather simple model. The medical model states that our health status, should be viewed through the individual and breaking the individual down into various parts. Is the brain healthy? Is the heart healthy? Is the cardiovascular system of our lungs healthy? Is the gastrointestinal tract, the stomach and intestines, is that healthy? Are the muscles healthy? Well, that's one way to look at a human being, but there are other ways that are more holistic. Let's talk about that. One way is the public health model. Public health model is different. We're with a public health model, we're trying to understand how an individual fits into a society and whether the surroundings for that individual give them the opportunity to be healthy. And we all know of environments, it can be work environments, it can be school environments, it can be all kinds of different home environments that are unhealthy. And by viewing how an individual fits into the society as a whole, that's called the public health model. So, in taking into account the public health model, what are some of the greatest achievements, public health achievements, that have occurred over the last century? Some things that people overlook are things like vaccinations. Vaccinations have dramatically decreased childhood deaths, the deaths of the elderly, and deaths for people of all ages. Oftentimes there's misinformation about vaccines and the risks of vaccines, but in actual fact, when we sit down and we analyze the results of vaccines, they're one of the greatest benefits to society. One of the best things you can do for both yourself, your family, and society as a whole is get regular vaccinations. Motor vehicle safety is another thing that has dramatically improved. Motor vehicles are still a leading cause of death in young people, particularly combinations of drinking and motor vehicles, or drugs and motor vehicles. Very, very dangerous, and can lead to death at high rates. I want to avoid that. Workplace safety has improved dramatically in the last 100 years. Its control of infectious disease has been improved. We've seen that with COVID. We're starting to understand diseases, cardiovascular deaths, as heart attacks and strokes. We need to improve our nutrition to help reduce cardiovascular deaths, as well as our exercise capacity. Safe and healthy foods have dramatically improved health. Maternal and infant care is an area in which the United States lags and needs to pay attention to improving maternal and infant care. Fluoridated drinking water has dramatically improved oral health. And tobacco, recognition of tobacco smoking as a health hazard has dramatically improved health in the United States. Unfortunately, smoking is still one of the leading causes of preventable death. So don't smoke. So what are the dimensions of health that we're going to talk about throughout this course? We're going to talk about intellectual health. Intellectual health is a little bit of a concept that may at first seem not obvious, but you need an intellect that functions. And examples where intellectual function is compromised includes things like dementia, perhaps drug addiction, Alzheimer's. The brain is not working correctly. It's clouded. It's not able to function properly. Sometimes mental disorders can also cause incorrect functioning in intellectual health. Not being able to think clearly is a problem in today's modern society. Emotional health. Emotional health is a big one. Emotional health affects us all and can drag our overall physical health down if we're unable to cope emotionally with stresses of life. And we all have stresses in life, so coping with those is very being resilient enough to cope with those emotional stresses is an important part of health. Environmental health, our surroundings, crucial part of our health. If we're in dangerous surroundings, if we're exposed to danger all the time, that is very unhealthy. Physical health, keeping physically fit, makes a huge difference. One of the biggest differences you'll see with improving physical health is improving mental health. Mental health and physical health go together. It's because the brain is not isolated from the body. We're a whole creature, and by improving our cardiovascular fitness, our strength, we're also at the same time improving our mental capacity. Spiritual health. That's not necessarily religious. For some people it is, but for some people spiritual health is more about the things in life that drive them. What do you want to do in the next 1,000 days? What are the ideas that really capture you? What is it that you want to become? What is it that you want to do in the next few years? What do you want to achieve? Write them down. Improve your spiritual health. And social health. This is enormous. It's really important. It's one of the factors that is the most difficult for college students, because you're in an environment, a new environment, where there's a lot of social change, a lot of new interactions, social interactions. It's very hard to get yourself out there, put yourself out there, meet new people. But it's been very well shown scientifically that the number of interactions you have, the number of social interactions you have, the healthier you are. The more, the healthier. And sometimes those interactions do not need to be very deep. It's great to have close friends, close family, but some of these social interactions can be quite light. But the more social interactions you have every day, the more you're exposed to other people, the healthier we tend to be. Human beings are very social creatures. Okay, so next we're going to talk about the factors that influence these factors of health. One of the key factors that influences us is our biology. It's our genetics, our age, ethnicity, gender. These are determinants that are non-modifiable. They're things we're more or less stuck with. Having said that, biology is not a factor that is overwhelming. We can bypass some of our biological hang-ups. My family has diabetes. We can sidestep some of these health issues through careful management of behaviors. So behaviors are a really important part of our overall health. And modifying behaviors through time is something that's going to be really important to you and your health. So an individual can respond to external conditions with different kinds of behaviors, and we also tend to form habits. Sometimes habits are bad habits and unhealthy habits, and sometimes habits are good habits, things like exercise, or bad habits like smoking. So we can modify our behaviors, modify our habits, and improve our overall health. It's a good idea to take an inventory of your behaviors and think, well, is that a healthy behavior? Is that less healthy behavior? Can I improve it? Okay, and we can all make changes. Be kind to yourself when you do that sort of analysis, because we all have behaviors that we're less than proud of or less than happy with, and changing those ingrained behaviors can take a great deal of time. You need to give yourself at least 1 month for any behavioral change, and it's usually not best to go cold turkey. Sometimes it's better to replace one habit, which is perhaps less healthy, with another habit that maybe is a slight improvement. Perhaps if you're a smoker, you might go to a nicotine patch, and it takes at least a month, sometimes longer, before you can actually make a meaningful change in your life. When you do make a meaningful change in your life, reward yourself. Well done, you did it. And take small steps, little steps. Maybe exercise is something that you'd like to improve. Start out small, walk around the block. Don't need to run a marathon immediately. It's one of those things that over time you can slowly increase your capacity and improve and adopt more and more healthy habits. By adopting more and more healthy habits a little at a time, and maybe piece by piece. Maybe you want to give up sugar. Don't go cold turkey. Maybe just halve the amount of sugar in your diet. Things like that. Okay, so health outcomes. We started talking about this a little bit here. We know that biology and genetics are factors that influence us. Social factors are important. Policies are important. Get out there and vote. Make sure that you have policies in place from your local government that will improve the life of yourself and your society, the people around you. Take advantage of health services. You're at community college. There are many, many health services, including counseling. Take advantage of those opportunities and get any help that you might need. And finally, individual behaviors. We started to talk about making healthy choices and choosing healthy habits.